Hello, my name is Christine Zaborski, and I'm going to be presenting today on animal-assisted therapy. Our textbook defines animal-assisted therapy as the use of specifically selected animals as a treatment modality in health and human service settings. Nurses so far have been one of the strongest advocates of animal-assisted therapy, and it's slowly been growing in popularity in the United States. It's shown to be a successful intervention for people with various medical conditions, and one of the earliest records of animal-assisted therapy was by Florence Nightingale in 1860. Going back through history, there's been many occurrences of animal-assisted therapy. So, all the way back in 900 BC, Homer wrote about a Greek god of healing who transmitted his healing powers through these special dogs. And then in the 9th century, people in Belgium started using animals to take care of other people with disabilities. In 1792, there was a retreat in England founded for people with mental illnesses, and part of their treatment plan was using small animals. Their goal was to decrease the use of restraints and medications, and they did this by helping the patients learn self-control through taking care of the animals. Some more examples of animal-assisted therapy in history. In 1876, a treatment center in Germany used pets as part of their treatment program. In the 1940s, injured soldiers were encouraged to work with different types of animals at the farm of the Army Air Corps Hospital. And ever since then, animals have just been used in a variety of different clinical settings, from acute hospitals to private homes to schools. One of the most important concepts in animal-assisted therapy is the idea that the animal provides a great bonding experience. Animals show unconditional affection, they're responsive, they're great companions, and all of this makes them really effective in therapy. The animal pays little attention to the age or physical ability of the patient and instead just accepts people as who they are. It's been shown that depressed older adults often brighten up and have a more positive outlook when they're participating in animal therapy. Animals can help people feel less lonely and less depressed. They can provide a change in routine or distract the patient from their disability or pain. People often talk to animals and share their thoughts and feelings because they aren't scared about how the animal is going to react, as opposed to when talking to other people. With animals, it's actually been shown that people's blood pressure tends to go down. Animals also provide common interests between strangers and help to stimulate socialization and conversation. So the most common types of animals used for animal-assisted therapy is either dog or cat. Other animals include parrots, cockatoos, guinea pigs, rabbits, llamas, donkeys, horses. A lot of different types of animals can be used. There are various diseases and medical conditions that can benefit from this type of therapy. But in order to see those benefits, specific goals must be defined first. So depending on the specific condition, those goals can either be physical, cognitive, emotional, or social. So take, for example, if we have a therapist and she's going to be using a dog in the animal-assisted therapy, some examples of goals could be increase the upper extremity range of motion. The patient could throw an object for the dog to retrieve. The patient could use a leash to help maneuver the dog. The patient could pet, stroke, or brush the animal. Another example of a goal could be mobility. They could walk with the dog. Another example of a goal would be improved memory. They can ask the patient to recall the dog's name, age, etc. And another goal could be increased language production. The patient can use commands with the dog or just simply talk to or about the animal. One type of animal-assisted therapy is therapeutic horseback riding. This is really effective because it can help increase the patient's self-confidence, improve their self-esteem, increase their sensory processing, improve posture, balance, mobility. Patients that can benefit from this include, but are not limited to, patients with cerebral palsy, people with orthopedic problems, people with scoliosis, people with developmental delays, and all the other medical conditions listed here. Another specific type of animal-assisted therapy is dolphin-assisted therapy. This therapy is considered newer, and it's not that common because it can be more expensive. Some of the medical conditions that it can help treat, some examples, I'll just list a couple. There's depression, speech disorders, traumatic brain injury, and Down syndrome. Apart from animal-assisted therapy, animals can be used in a variety of ways. There are service animals, so animals such as guide dogs, seizure response animals, respiratory service dogs, things like that. There are animal-assisted activities, which they're kind of like visitations to sheltered homeless families, so it kind of gives the children an opportunity to interact with pets and do things that they normally wouldn't be able to do. There are pet visits, so this can be in a patient, they can be visiting patients in a healthcare setting. The pet can be the patient's or part of the pet therapy program. There are also screening dogs. Because dogs have like such a great sense of smell, they are trained to detect prostate cancer just by smelling urine. They can detect lung cancer just by smelling people's breath, and skin cancer just by smelling the patient's entire body. I thought very interesting. I never knew about that before. Dogs are also used in correctional settings, so prisoners are responsible for the care and well-being of the dog. People who are against animal-assisted therapy oftentimes bring up the contraindications. So some examples include the patient can have a significant phobia of the animal. The patient can express a disinterest in the animal. The patient may not be able to treat the animal in an appropriate, humane way. And a patient with a medical condition in which exposure to the animal could worsen their current health. So people who are immunocompromised, people who have open wounds or sores, and people who are allergic to the animal are considered contraindications. There are many advantages and disadvantages to using animal-assisted therapy. I'll start with the advantages. Animals provide unconditional affection, companionship. They can help people feel less lonely, less depressed. They can provide a change and distraction from pain. People are more open to talk about their feelings and emotions. People's blood pressure tends to go down. And animals stimulate socialization and conversation. Some disadvantages of animal therapy is that it can be expensive. Just to train one service dog usually costs more than $10,000. The animal also needs to be cared for properly. Animals are vectors to transmit disease and bacteria. And also, the research behind this type of therapy isn't really the strongest. Much of the literature is anecdotal, and most studies recommend further investigations because they show associations but not actually causal relationships. Some side effects of animal-assisted therapy: patients who are allergic to them may have a reaction during pet therapy. The pets can transmit disease or illness. The patient may have a fear or anxiety or develop a fear or anxiety of the animal. And also another one that I thought was interesting was the patient can create a bond and could become attached to the animal. So if the therapy stops abruptly, the patient may suffer from disappointment and other negative side effects, and this is most common with children. Animal-assisted therapy is gaining acceptance, but there is still a little bit of reluctance and skepticism on the part of many administrations and healthcare facilities. Animals used to be banned from healthcare facilities, but now are gradually being welcomed as more and more research comes out. Most of the literature done on this type of therapy, like I mentioned before, has only been anecdotal, but more and more scientific research is starting to appear. So I found a research article that I thought was very interesting. This was a randomized study done on the post-operative benefits of animal-assisted therapy in pediatric surgery. The article states that the purpose of the study was to better understand the impact of an animal-assisted therapy program on children's response to stress and pain in the immediate post-surgical period. The children were enrolled either in a therapy group or a control group. The therapy group went a 20-minute session right after surgery. Results indicated that the therapy group facilitated rapid recovery in vigilance and activity after the anesthesia. It showed modified pain perception and induced emotional prefrontal responses. Requirements for this type of therapy: the patient must be cleared by the physician. They must have no allergies to animals, no open sores or wounds. They can't be immunocompromised and must not have any phobias of the animal. And there's also requirements for the animal that's participating in the therapy. The animal has to be of good temperament. They have to be obedience trained. The animal must be at least 1 year old before enrolling in the training. A veterinarian must verify the animal's health, and the animal must have a high tolerance for unfamiliar or loud noises and peculiar smells. I just have 2 review questions here for you guys to think about. First question is, from what you've learned so far in this presentation, do you believe that animal-assisted therapy is effective? Do the benefits outweigh the risks? And should more facilities implement this type of therapy? Why or why not? My second question is, have you personally encountered or been part of animal-assisted therapy? If so, explain the benefits you experienced, and if not, describe another experience you have had with animals and describe its effect on you and your health. I hope you've enjoyed this presentation, and I hope you are able to learn something new about animal-assisted therapy. Thank you so much for your time.